For 14 years, General Edmund Carver had not been able to sign his own name. That was the thing nobody talked about. Not the Tremors, not the specialists, not the 7 neurologists across 4 states who had each, in their careful clinical language, said the same thing. What nobody said aloud was that a man who had commanded 40,000 soldiers, who had shaken hands with 3 presidents, who had carried his daughter down the aisle of St. Francis Cathedral in Charleston on a perfect June morning in 2007, that man had not been able to sign his own name since the helicopter went down in Kandahar in the autumn of 2009. Before we go any further, if this story is already pulling you in, do me one small favor. Hit that like button. Drop a comment and tell me what city, what state, what country you're listening from tonight. And if you haven't already, subscribe. You're with Quiet Badges Stories, and every person we talk about here wore something quiet and heavy for a long time before anyone thought to look. Let's begin. Dr. Raymond Whitmore arrived at Harwick Medical Center at 8 o'clock on a Tuesday morning in March, and did 4 things before he reached his office. He checked his phone, handed his coat to the resident trailing behind him, asked the front desk if his 8:45 had arrived, and walked past the nurse's station without looking at anyone standing behind it. Jess Hartwell had been behind that station since 6:15. She had already restocked the supply cart on 4, replaced an IV line the overnight nurse had missed, talked a post-op patient's husband down from calling 911 because his wife hadn't woken up fast enough for his liking, and written 3 pages of intake notes in the tight, compressed handwriting of someone who had once written reports that other people weren't allowed to read. She was 38 years old, 5'4", dark hair pulled back at the base of her skull, a few strands loose at the temples the way they always were by mid-morning. She wore blue scrubs, bright and clear as a June sky. Above her name tag, pinned to the chest pocket, was a small enamel patch. A gold compass rose on a field of dark green. Nobody at Harwick had ever asked what it meant. Her left forearm carried a scar, long and pale, running from just above the wrist to the crook of the elbow. Shrapnel. Most people assumed she had caught it on a cabinet door. She had never corrected anyone. When Whitmore walked past without looking, Jess was reviewing the morning roster. She had already seen the name at the top of the consult list. General Edmund Carver, U.S. Army, retired. Age 67, presenting complaint, progressive loss of fine motor control, right hand and forearm, duration 14 years. Referred by the VA Neurology Department at Hines after the latest round of imaging showed what Whitmore had described in his notes as concerning cervical instability at C5-C6, requiring prompt surgical evaluation. She read it twice, then she read the intake summary again. She did not reach for the chart. She walked to the window at the end of the corridor and looked out at the parking lot. She stood there long enough to make a decision. Then she walked back to her station. Room 7 was at the far end of the hall. Through the glass, Jess could see 3 people. A woman in her mid-40s, dark suit, a strand of pearls at her collar, hands wrapped around a paper coffee cup so tightly the cup had lost its shape. A young man, 20 or 21, in a college sweatshirt, standing just behind her with his shoulders slightly forward. The way young men stand when they have decided, without being told, that they are the wall between something and someone they love. And in the chair by the window, a man. He had been large once. You could see it in the frame, the width of the shoulders, the length of the arms, the way the exam chair was slightly too small even now. He wore a gray button-front shirt tucked into dark slacks. His left hand rested on his knee. His right hand lay in his lap, and even from the corridor, even through the glass, Jess could see the tremor in it. A small, continuous movement, barely visible but constant, like a compass needle that couldn't find north. She pushed the door open. "Good morning. I'm Jess Hartwell. I'll be your nurse this morning." The woman looked up. Her eyes were dry but had been crying recently. The redness sat in the outer corners, the way it does when someone has cried so many times that the act has become efficient. "I'm Sylvia Carver-Moss. This is my son Ben, and this is my father, General Edmund Carver." Jess looked at the general. He was looking at the window. His jaw was set. His left hand had stilled on his knee. His right hand continued its small, restless movement. "General, it's an honor, sir." He turned. His eyes were a deep, quiet gray. The eyes of a man who had been spoken to with the careful, padded gentleness of the medical system for 14 years and had stopped believing most of it. "Ma'am, just that." Jess wrapped the cuff around his left arm. Blood pressure, pulse, temperature. She wrote the numbers without comment. Then, quietly, she moved to his right side. She did not reach for his hand. She looked at it. The tremor was rhythmic. Resting tremor, right side only, 4 cycles per second. The kind of presentation that a civilian neurologist would log as essential tremor and treat accordingly. The kind of presentation that looked nothing like what Jess believed it actually was. She moved her eyes up his arm to his shoulder, to the base of his neck. There. Just behind the right ear, below the hairline, at the junction where the mastoid bone met the soft tissue of the neck. A small scar. Round, about the size of a pencil eraser, flat and pale, the kind of scar that had been there so long it had stopped having edges. To anyone who had not spent years studying post-field intervention markers at a research unit in Maryland, it would have looked like nothing at all. Jess did not let her face move. "General, may I ask, did you receive any kind of treatment in the field the night of your injury, before medevac?" The general looked at her for a long moment. His gray eyes moved across her face the way a person reads a map, methodically, from one landmark to the next. "There was a sergeant with a medical kit," he said. "Before the bird came, he did something at the base of my neck, told me it would help with the bleeding." "Thank you, sir." She stepped back and was writing in the chart when the door opened, and Whitmore walked in. He was 61, tall, silver at the temples, the kind of man who wore his department chair credentials the way other men wear a watch. Not for function, for information. His white coat was spotless. He did not look at Jess. He lifted the chart, read for 45 seconds, set it down. "General Carver, I've reviewed your imaging from Hines and the prior consult notes from your neurologist in Charleston." He looked up. "I'll be direct with you. The tremor as presented is secondary. Your primary concern right now is structural. The C5-C6 instability we're seeing on the MRI represents a fracture risk if left unaddressed. I want to schedule a cervical fusion for Thursday." Sylvia's hand went white around the coffee cup. "A fusion, we were told." "I understand what you were told. Previous providers were focused on the neurological presentation. That was their training. Mine is surgical. The instability is the threat. The tremor is a symptom. We stabilize the spine, we address the symptom." The general had not moved. He was looking at Whitmore with the flat, unreadable expression of a man who had sat across from people who were wrong for the entirety of his career, and had learned the particular silence that comes before a response. "And the tremor itself, doctor?" Whitmore's mouth pressed thin. "The nerve involvement at that level is chronic. 14 years is a long time. We may see some improvement post-surgery, but I want to be transparent. The primary goal is stabilization." Jess set the chart down on the rolling tray. She looked at the general. He was looking at his right hand. What she saw in his face in that moment was not despair. She had expected despair. What she saw was something quieter and more permanent, the expression of a man who had stopped being surprised by closed doors. That, more than anything else, broke something loose inside Jess Hartwell. "Dr. Whitmore." He looked at her for the first time. His expression was the expression of a man who has been interrupted by the copy machine. "Ms." He glanced at her badge, "Hartwell, I'll need you to begin the pre-surgical consent process." "Before you do that," her voice was flat and even, "I'd like a word with you in the hallway." "I beg your pardon." "In the hallway, doctor, 2 minutes." The room was completely still. Sylvia had stopped breathing. Ben had put his hand on the back of his grandfather's chair. Whitmore smiled. The kind of smile that doesn't involve the eyes. "Nurse Hartwell, I don't take clinical input from floor staff." 2 minutes, before you schedule anything." He looked at her for 3 full seconds, then he turned and walked out. Jess turned to Sylvia. "Don't move, don't sign anything. I'll be right back." The corridor was empty except for the hum of the overhead lights. Whitmore turned to face her, arms crossed. "Make it fast." The scar behind the general's right ear, behind the mastoid process, below the hairline. Whitmore stared. "What about it?" "It's an implant marker. Microelectrode array, subdermal placement, designed for field application in acute cervical spinal trauma. The array maintains peripheral nerve conduction in the right brachial pathway by routing signal around the damaged C5-C6 segment. It doesn't heal the injury, it preserves the pathway. Doctor, the tremor isn't degeneration. It's the implant attempting to compensate without calibration. It has been doing that for 14 years without anyone knowing it was there." Whitmore's arms dropped half an inch. He caught them. "That technology doesn't exist." "It exists. It just doesn't exist in any journal you've read. It was developed for field application in Special Operations Medical Protocol between 2009 and 2014. Classified until 2019. Doctor, if you fuse that spine Thursday without addressing the array first, you will sever the only compensatory pathway this man's right arm has been relying on for 14 years. He will lose the hand entirely. You are a floor nurse. You are not a neurologist." "Dr. Whitmore." Jess did not raise her voice. "I need 6 minutes with the patient. After that, I will give you every piece of documentation I have. But I need 6 minutes before you make a decision that cannot be undone." The silence between them was specific. The kind of silence that happens when a person realizes they are looking at someone who knows more than they are showing, and hasn't yet decided how much to reveal. Whitmore uncrossed his arms. 6 minutes, then I'm calling the department head." Jess walked back into room 7. She walked to the supply shelf and opened her own bag, the dark canvas one that sat beneath the shelf, not the hospital bag. She removed 3 items, a pen light, a patient intake form she didn't need, and a flat black case approximately the size of a hardcover book sealed with a 2-pin latch. Whitmore took 3 steps into the room and stopped. What is that? Nerve calibration array, external, non-invasive. Jess set the case on the rolling tray and unlatched it. Inside was a device that looked like nothing in particular, a soft matte panel about the size of a playing card, 2 contact points, a slim wire connecting to a controller no larger than a pocket calculator. Simple, hand-built, 7 years old. She had carried it in her bag every single day since she left Fort Detrick. She had never opened the case until now. That is not standard equipment. No, doctor, it is not. Whitmore took a breath to speak. The general spoke first. Let her continue. 2 words, quiet. The voice of a man who had once told 40,000 soldiers when to move and when to hold and had not forgotten how to use it. Whitmore closed his mouth. Jess looked at the general. Sir, I'd like your permission to place this panel on the back of your right hand and at the base of your neck near the implant. I'm going to run a calibration signal, very low frequency, no stronger than a tens unit. You may feel warmth, you may feel tingling. If you feel pain, you tell me and I stop immediately. Do I have your permission? The general looked at her. He looked at the compass rose pin on her chest. He looked at the scar along her left forearm. Yes, ma'am, you have it. Sylvia, will you take his left hand? Sylvia moved without thinking. She wrapped both her hands around her father's left hand and held it. Ben stepped back against the wall, arms crossed over his chest, jaw set, eyes very bright. Jess placed the panel flat against the back of the general's right hand. She moved his collar aside 2 inches and placed the second contact point at the base of his neck, just below the implant scar. She looked at the controller. She set the lowest frequency. She pressed the trigger. The general's right hand went still. Not twitching, not seizing, still. For the first time in 14 years, the tremor stopped. Sylvia made a sound, small and broken, the kind that has been held in so long it doesn't come out the way it went in. Ben pressed his fist against his mouth. The general looked at his hand. He looked at it for a very long time. His jaw worked slowly. Jess said quietly, Sir, I'm going to ask you to try something. She picked up a pen from the rolling tray and placed it in the general's right hand. His fingers closed around it, slowly, with more effort than a pen should require, and with something that was not effort at all, something older and more fundamental, the return of a signal that had been trying to get through for 14 years. The general held the pen. He turned it in his fingers, 1 rotation. Just enough to grip it the way you grip a pen when you are about to write something that matters. Whitmore had not moved. His tablet was in his hand, but he had forgotten it was there. The general set the pen down. He laid his right hand flat on his thigh, and it did not shake. He looked at it, and the expression on his face was the expression of a man who has just heard a voice he was certain he would never hear again. Sylvia was crying without sound, the kind of crying that happens when a person has cried so many times that the sound has worn away, leaving only the tears. Ben did not cry. He sat down on the edge of the exam stool behind him, put his elbows on his knees, and looked at his grandfather's hand with the expression of a young man updating every memory he had ever made of the person in front of him. Jess lowered the controller. She didn't speak yet. Whitmore stepped forward. He stood at her left shoulder and looked at the general's hand, still. Hartwell, his voice was different from the hallway. What did you just do? Jess looked at him, then at the general. Sir, with your permission. The general nodded once. She turned to Whitmore. The implant behind his ear is a brachial pathway preservation array, developed by the Army's Joint Neurosurgical Innovation Group between 2009 and 2014. In the field, a special operations medic placed it within 2 hours of the general's injury. The array routes the motor signal for the right hand around the damaged C5-C6 segment. 14 years with no calibration has caused signal drift. The tremor is the unsynchronized attempt of the preserved pathway to re-engage muscle function without a coordinated input. What I just did is recalibrate the input frequency. The pathway is intact. The muscles are atrophied but present. If you fuse that spine without knowing this, you sever the array's anchor point and kill the pathway permanently. Whitmore did not speak for a long moment. Why doesn't any of his imaging show this? The array is biocompatible titanium mesh at a micron thickness. It reads as scar tissue on standard MRI. You need a specific frequency band to distinguish it from native tissue. That information was in the declassified technical appendix published by the Army Medical Research Command in 2019. 9 pages long, published as a footnote to a logistics report. A footnote. Yes, doctor. Whitmore's jaw moved. He looked at the general. He looked back at Jess. "Who are you?" Jess did not answer immediately. She placed the controller on the tray. She picked up the pen she had set in the general's hand and held it for a moment. Then she set it down. "My name is Jess Hartwell, doctor. I'm the floor nurse." She paused. "Captain Jessica Hartwell, United States Army, retired. Call sign Compass. Medical Officer, Joint Neurosurgical Innovation Group, Fort Detrick, Maryland, 2011 to 2016. Our unit tracked field outcomes for soldiers who had received the brachial array in theater between 2009 and 2014. Most of those soldiers were never told what the medic had placed in their neck. The implant was classified. The program was shut down in 2016 after a budget reallocation. The soldiers went home. Nobody called them." The general turned his head slowly toward her. His right hand was still resting on his thigh, still. "I was on your list." "Yes, sir, you were." The general closed his eyes. He kept them closed for nearly a full minute, the way a man holds stillness when he knows that showing what he feels will cost everyone in the room something they shouldn't have to pay. Then he opened them. "How many others?" 31 received the array in theater, sir. 19 were confirmed alive at the time of program closure in 2016. I don't know how many since." Whitmore had lowered his tablet. He sat down in the chair beside the exam table, something Jess had never seen Raymond Whitmore do. "Captain." His voice was entirely different now. Not the voice from the hallway. Not the voice of the department chair. The voice of a man who has just been shown the edge of what he doesn't know and is measuring the distance to the bottom. "I was going to operate on this man in 48 hours. "I know, doctor." "I would have severed the array." "Yes." He looked at his own hands for a moment. He said nothing. "What do you need?" Jess picked up her legal pad from the tray. She had been writing in it since 6:15 that morning in the tight, compressed shorthand of someone who had spent years writing things other people weren't permitted to read. "I need a cervical MRI at the 0.5 Tesla frequency band. Your radiology team will need the protocol from the 2019 appendix. I need an EMG of the right upper extremity. Full motor mapping. I need the surgery cancelled and the general admitted for observation and calibration over 3 days. And I need to make a phone call to a colleague in Bethesda who still has the implant specifications on file." Whitmore stood. He straightened his tie. He looked at the general. "General Carver, I owe you an explanation and an apology. I was prepared to operate on a condition I did not understand. That decision would have been permanent and wrong." The general looked at him with the steady, unreadable calm of a man who had been failed by more dangerous people than this and had survived every one of them. "Doctor," he said, "the most dangerous men I've ever met were certain." He paused. "You have a chance to stop being certain, I'd take it." Whitmore nodded once. He looked at Jess. "Surgery is cancelled. I'll order the imaging." He paused at the door. "Hartwell." "Yes, doctor." "You should have been in this room a long time ago." She did not answer that. She turned back to the general. "Sir, the calibration will hold for approximately 72 hours. For long-term function restoration, you'll need a rehabilitation protocol specifically designed for brachial re-engagement post-array. That doesn't exist in civilian medicine yet, but I can build it." The general looked at the compass rose on her chest for a long moment. "Captain, how long before I know whether the hand can come all the way back?" She told him the truth. She had learned that the only thing worse than the truth was watching someone wait for you to find the courage to give it. "The pathway is intact, sir. The array is intact. But 14 years is 14 years. You'll work harder in the next 6 months than anything outside of combat. At the end of it, I believe you will write your name again. I will not promise you more than that, but I will promise you that." The general reached out with his right hand, his still right hand. He picked up the pen from the rolling tray. He looked at it. He placed the tip against the corner of the intake form and drew one slow, unsteady line. Not a letter, not a word, just a line. Proof that his hand and his brain were connected again by something that had been trying to find each other across 14 years of silence. Ben turned toward the window. He stood with his fist pressed against the glass and his shoulders moving and made no sound at all. Sylvia did not let go of her father's left hand. That night, after the shift had emptied, Jess sat at the nurse's station and wrote on her legal pad. She wrote the numbers she remembered, 19 names, the ones she had been told to leave alone when the program closed, the ones she had thought about every day for 7 years and done nothing about, because doing something would have meant admitting that she had been carrying a case in her work bag, and a list in her head that she wasn't supposed to act on. She turned to a new page. She wrote General Carver's name at the top. Below it, she began to write the others. Within the week, the story broke in local news. Not the way Jess had expected, not the classified program, not the military angle. What broke first was the image. The general in his gray button-front shirt, sitting in the exam chair at Harwick Medical Center, with his right hand closed around a pen, his daughter's hands wrapped around his left, his grandson against the wall, looking at him the way people look at things they were afraid they'd never see again. The calls started the following Monday. A woman from Fort Wayne, Indiana. Her husband, a former Army Ranger, had been dealing with what every specialist called irreversible nerve damage to his left arm since 2011. Small round scar behind his left ear. She had seen the news. Jess took the call at the nurse's station on her lunch break. She listened. She wrote the name on the legal pad. Then she said, "Mrs. Aldridge, someone is going to call you back within 24 hours with a date and a plan. Your husband's name is on a list. He has been on a list for a long time. We just found the list again." The woman was quiet for a moment. Then, in a voice that had been carrying something heavy for 11 years, she said, "Does that mean someone new?" Jess looked at the compass rose pin on her chest. "Someone should have known sooner. I'm sorry it took this long." By spring, the Harwick Peripheral Array Recovery Program had 7 patients enrolled and 3 more scheduled. Whitmore had, without announcement, quietly approved every resource request Jess submitted. He had also, without being asked, withdrawn his name from a panel on cervical fusion outcomes at a conference in Minneapolis, and called the program chair to recommend Captain Hartwell speak in his place. She declined. She sent her written protocol instead. The ceremony at Harwick Medical Center in June was not supposed to be a ceremony. It was a clinical review, which became a department presentation, which became something the dean of the medical school attended, and then the Veterans Affairs liaisons, and then a representative from the office of a senator on the Armed Services Committee, and then it was a ceremony whether anyone had planned one or not. The general was in the front row. He was in his uniform, Army service uniform, 4 stars. He had not worn it in 7 years. His daughter had driven it to the tailor 3 weeks before because the last time he had worn it, he had been a different size in the shoulders, and she had said he had earned the right to wear it correctly. He walked in on his own. Not with a cane, not with a walker. He walked in because the rehabilitation protocol had restored enough grip strength and fine motor coordination that he had, 2 weeks prior, done something he had not done since the morning before his helicopter lifted off a forward operating base in Kandahar in October 2009. He had shaken someone's hand. It had been his grandson's hand in the hallway outside the rehabilitation gym at Harwick, and Ben had not said anything. He had just gripped back. The 2 of them stood in the corridor with their hands locked together, and then Ben had pulled him into a hug. The kind that young men give when they have stored it up for more years than they should have had to. When the general stood at the lectern, the room went completely quiet. He had no notes. 40 years of speaking without them had left him better off without. 14 years ago, he said, a sergeant whose name I never learned put something in my neck and told me it would help. He was right. He could not have known how right. He looked across the room. Every person here has given time and skill and sometimes courage, because it takes courage to tell a more senior person that they are wrong. I know something about that. He looked at Jess. She was in the second row, blue scrubs, bright as the June morning outside, the compass rose pin above her name tag. "There is a nurse at this hospital," the general said, "who carried a piece of equipment in her work bag every day for 7 years. She carried it against the instruction of the people who shut down her program. She carried it because she believed that the men on her list deserved to have it carried for them, even when she couldn't use it yet, even when she didn't know if she ever would be able to." He stepped from behind the lectern. He walked to where Jess was sitting, 3 steps, steady. He stopped in front of her. He brought his right hand up to his temple. He saluted her. From the front row, 3 other men in the program rose. One needed a cane. One had a brace on his right wrist. One stood without either. Each of them brought his hand to his temple. Jess's throat closed, her eyes did not. She stood. She raised her right hand, the one with the shrapnel scar, the one that had carried that case for 7 years, the one that had placed a 2-centimeter contact point at the base of a general's neck on a Tuesday morning in March. She returned the salute. The general lowered his hand. He reached into the breast pocket of his uniform and removed a pen, plain, dark metal, unremarkable. He placed it in her hand. "Keep it," he said quietly, "in case someone else needs a reminder that the road is still there." Jess closed her fingers around it. "Thank you, sir." Afterward, when the room had thinned to families and staff, and the particular quiet that follows something no one quite has language for, the general found her near the door. He said quietly, just to her, "I signed my daughter's birthday card last week." Jess looked at him. By hand. He said it the way people say things they had stopped believing they would ever say, with that pen. She held herself together for a moment. Then she said, "Was it the right date?" His eyes went quiet in a particular way. Then he said, "First time I've been early in 67 years. She smiled, he nodded once, he walked back to his family. Jess stood in the doorway of the function room. Through the tall corridor windows, the Chicago afternoon came in clear and long-shadowed, the same hallway she had walked every day since she had taken this job. The same lights, the same smell of antiseptic and recirculated air, and the specific silence of a building that holds 1,000 things people are afraid to say out loud. She walked back toward the nursing floor. At the station, she stopped. She set the general's pen down beside her legal pad. She picked up the stack of incoming charts for the next morning and flipped to the second one. The name stopped her. A notation in the referral field flagged by a civilian intake coordinator as a skin abnormality for dermatology consult. Small round scar, posterior right auricular region. Patient unable to explain origin. Jess set the chart down. She looked at it for a long moment. Then she reached beneath the station counter and picked up her work bag. She checked the latch on the black case inside, still sealed. Still there, she put the bag back. She wrote the name at the top of a fresh page on the yellow legal pad. She clipped the pen to the cover. She turned off the desk lamp. She walked to the end of the hall and pushed through the door into room 7. "Good morning, I'm Jess Hartwell. I'll be your nurse today."